Hello everyone and welcome to today's MHRA RegulatoryConnect portal launch webinar, which will last around 90 minutes. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You have joined the presentation in listening only mode using your computer speaker system by default. However, you will have the opportunity to submit text questions to today's presenters via Slido at www.slido.com using the event code #RegulatoryConnect24. Again, the event code is #RegulatoryConnect24. You may send in your questions at any time during the presentation. We will collect these to address them during the Q&A session at the end of today's presentation. Please note that we will not be accepting questions via the GoToWebinar chat function, only for technical issues. It is now my pleasure to introduce your first speaker, Mick Foy, Director of Delivery, MHRA. Over to you, Mick.
Thank you very much, and good afternoon, everyone, and welcome to this webinar. We're here today to bring you up to date with our new RegulatoryConnect portal and give you a demonstration of that. But before we get into that, it's my job as SRO, which is Senior Responsible Owner for the RegulatoryConnect program, to just give you an orientation of our program, what we're about, and what you can expect to come in the future. So if we go to the next slide. So you may have heard of this program previously referred to as RMS or the Regulatory Management System. We took a conscious decision a couple of months ago to change the name of the program to RegulatoryConnect. We also have another program in flight called Safety Connect, and this is really about how we internally connect our systems so our assessors have better access to the wealth of data that the agency holds in order to do their job, but also how we connect to stakeholders, particularly the pharmaceutical industry and those that use our services for the registration of new products. So really, RegulatoryConnect is about achieving a transformed set of services that the MHRA delivers that meet the needs internally and externally. It's largely also about replacing legacy systems. We have, at present, we are operating on a couple of very old legacy systems. Our Sentinel database, for example, has been in service for around 20 years and is very difficult to maintain. It's very expensive to maintain and is not fit for the future, and we need to replace that. We're also, in doing so, consolidating our technology platforms into simpler cloud-based solutions. So our mission is to use this opportunity in RegulatoryConnect to really deliver our ambitions around being a world-class standalone regulator. Post-EU exit, we have the opportunity to move away from some of the procedures that are embedded in that and be more streamlined and efficient. We're looking at bringing in a number of services that can be operated via self-service. This all goes to making us a more efficient regulator, improve our working practices, but also we want to be open and trusted source of information. And what you will see today with regards to our portal is the first step in that journey of opening your doors to access information at the right level, so you can really engage with the MHRA in a much better way than maybe you can do currently. We go to the next slide. I think I'd probably sum this up. Our strategic vision is to be a risk proportionate regulator. So if we can make our services more streamlined, maybe for those procedures and processes that are of low risk, that can free up time so our assessors can concentrate on those really innovative products, where at present some of our processes, procedures and technology require a manual effort that is not risk proportionate to the procedure in question. I've mentioned the connecting theme, and again, this portal is the first step on that journey of better connectivity between the agency and our stakeholders. So really, can we bring those efficient services into play that allow for us to concentrate on innovative products so that they reach patients without delay? There is a current pressure on the agency with regard to the volume of work that we have in our in-tray, and our performance needs to be improved, and we have separate initiatives underway to do that. But really, we need to make sure that the procedures that we are responsible for and the authorizations that rest with us can go through our system without delay, so patients get access to the products that they need. And this reduces burden on yourselves, on ourselves, and also by utilizing our data better, we can share that more easily, more readily with stakeholders. Next slide, please. So we took a view a few months ago when we were looking at the previously known RMS project, which was subject to some delay, to try and break it up into release cycles so that we could get some low-hanging fruit and get some features and functions of the program out earlier than in the previous plan would have otherwise been possible. So we are in the midst of delivering release 1. We made a commitment in our corporate plan that the first release of RegulatoryConnect would be complete by the end of March. That's the end of our business year, and we are on track to do that. You'll see that the RegulatoryConnect portal is just one element of what we are releasing in this release 1. We're also bringing in the new ECTD management tool, the Lorenz DocuBridge tool, that will enable our assessors to access the ECTD dossiers much quicker, making their job easier, more efficient. We're bringing in new search tools and reporting tools on our legacy data, so again, our assessors, our workforce are able to search and access information that, using the current systems, is a little bit clunky, let's say. We're bringing in a new reporting domain for our inspectors, and this will grow out over time. But this is some of the early releases that are the beginning of a journey for what we're calling release 2, which we are planning towards the end of the year as the release that will then finally replace those old legacy systems that I mentioned. So release 1 is happening now and will be complete by the end of March, and release 2 is working in parallel, and our plan is to do all of the design, build, test in time for release in around the November time. Next slide, please. So this is the overview. We've spent a lot of time looking at our technology platforms and our data model, and this is really some of the hardest elements of the program, is bringing in new technology platforms, redesigning our data model in the standards that we should be using, IDMP, etc. All of the SPOR elements of IDMP, making sure that our data is consistently captured and structured in those modern data standards. The core technology platforms are really the assessor interface and the inspector interface workflows, etc. We've also created what's called a legacy archive. Rather than migrating all of our data into that core RegulatoryConnect platform, we're archiving it for access to our assessors, and that work is part of release 1 also. Common services are a number of features that are used internally, not least the reference information for invoicing. All of our, or a number of our services have a fee attached to them. So we're modernizing how those fees are attached to a procedure, which will make life, again, a lot more streamlined, a lot more efficient internally. All of this underpins our new services for product and process licensing. So all of the types of authorizations that we're responsible for, and all of the inspections that are associated with that. We're also bringing in new services for imports of import notifications, unlicensed medicines, and the registration of medical devices. That's release 1 and release 2, but you'll see there the kind of dotted outline future projects. We have placeholders for release 3, release 4, which we aim to build out upon what we're doing in the current releases to really maximize the opportunity of this program. We'll be looking at things like how artificial intelligence can be used to further improve the services that we provide. So more to come, but actually in the pipeline at the moment, release 1 up until March and release 2 through the remainder of this calendar year, which will be the replacement of our IT with those new services. But then that provides us a platform to build out future services and have a continuous improvement element to the program. The next slide, this really brings into scope all of the areas that I've mentioned. So product licensing, process licensing, inspections, the regulatory intelligence tools used both internally and externally, and those things like import notifications, unlicensed medicines, borderlines, etc. You can see on the slide the scope of services that are included in this program. And then on the right hand side, as I say, we have placeholders for further releases to do continuous improvement and extend the scope to other areas of the agency's work. You'll see there the common services and the technology elements of the program, but really it's those services that you'll be interested in. What areas of work that you're involved in are changing through this program. So the next slide, I think, is probably the end of my introduction. I hope that gives you an orientation of the program, what we're about, what we're seeking to deliver. We're in an exciting period in the program that the first release of the RegulatoryConnect portal for your use is being made available in the next few weeks. And Ollie here will take you through that journey and how you will get to use this new system. Over to you, Ollie. Thank you.
Thanks, Mick. So I'm Oliver. I'm the product manager for the first release of the RegulatoryConnect portal that will launch at the end of March. So I'll provide a brief overview of the first release before then presenting a short demo of some of the functionality that will be available to users from the end of the month. So the RegulatoryConnect portal will provide greater transparency and visibility over regulatory assessments and timelines for industry. The functionality that will be released will let you log in to the portal using existing submission credentials that are used for the Human Medicines portal, and you'll be able to access RegulatoryConnect for 2 core services. The first one is Track My Case, which will allow you to track the status of your application and see what workflow stage it's at. The second service is the See My Data service, and this will show your live authorization details, including the status of the authorization and key data held against your license. Those services will be available to everyone that's making applications to the MHRA on behalf of your organization. And as Mick said, the intention is very much that the portal will become the foundation for what longer term will be the front door to the agency as more services are brought onto the platform. So future functionality and features will be added, including the ability to access user account management and different account permissions, the ability to manage data that's held against your organization, functionality for managing invoices and payments as well. And most importantly, of course, the ability to submit applications for product or process licensing for both initials and variations. So if it's possible to go to the next slide. Throughout the program, we've been engaging frequently with industry, both in terms of doing detailed usability testing sessions and walking through designs and end-to-end journey flows, but also doing concept testing and walkthroughs of high-level service designs for the new services. And since the last webinar that we've run, we've organised over 36 usability testing sessions and 8 workshops as well, looking at some of those concept testings I mentioned. Specifically for the first release of the portal, for the March release, we've run workshops with industry groups, and 96% of those attendees felt that the services would provide greater transparency. And 96% also felt the visibility of seeing the data held against their license would add value to their company. And also we had unanimous feedback that seeing the documents, so the summary of product characteristics, the patient information leaflets, and also labeling documents would add value to their company as well. We are currently also going through a private beta testing period with a small group of organizations as well. So we're also testing the platform in advance to full go live at the end of the month. On the next slide, you'll be able to see more details around the data that will actually be presented through the platform. So the Track My Case service will show the status of anything pending, excluding information updates and periodic safety update reports. You'll be able to see anything pending as well as the latest granted submission for all live authorizations. You won't see any historically cancelled licenses, and you also won't be able to see the actual data for submitted or in-flight submissions. You'll be able to see the workflow status and high-level information for the type of submission for each of those cases. The second service, the See My Data service, shows key data that's held against your live authorization. So for product licenses, the data set will be based off of the same data that's currently shown through RAMA Excel for those customers that are familiar with that service. And also it will present key documents. So as I mentioned on the previous slide, the SPC, the PIL and labels will be provided through the portal as well. It's important to note that data will be refreshed every 24 hours. So the data is currently being pulled from our existing case management system and will only show and be displayed on the portal once the case enters the data validation stage. And as it's pulling from existing systems, the data is not currently synchronous with submissions being made. So there may be a short delay with your cases appearing. So if you can't see a submission that's just been made, don't be alarmed. We'd recommend just waiting a few days and the case should then be displayed through the portal. In terms of the benefits that the service will bring, you'll be able to familiarize yourself with the portal that will be the longer term front door for the agency in terms of being able to manage your license. So whether you wish to apply a sunset clause, for example, or cancel or raise a variation against your license, you'll be using a very similar self-serve interface based on Gov UK and GDS best practices for web forms. You'll also be able to self-serve viewing the status of your cases and applications. So that will reduce the need to contact the agency to check the status of your workflow of your applications and cases, and in turn will bring greater efficiencies on the agency side as well. The See My Data service will also provide greater transparency of the data that's held against your license and help to ensure accuracy of that data and enhancement in data quality. And lastly, the services will provide many of RAMA Excel's capabilities to a much wider audience as well. So I'll now pass over to our events team to play a short demo of the RegulatoryConnect portal and showing some of the functionality that will be available from the end of March.
I'm the product manager for the first release of the RegulatoryConnect portal. I'll provide a demo of the portal and its first self-serve tools, which will be available to customers from the end of March. The RegulatoryConnect portal will provide greater transparency and visibility for regulatory assessments and timelines. The first release will let users log into a common portal using their existing submission credentials to access 2 self-serve services. This is a foundation for what longer term will become the front door for the agency. Other services will be brought onto the RegulatoryConnect, including a full end-to-end regulatory case lifecycle, from submission through to assessment and then determination, as well as inspections and longer term also devices and import notifications. On first accessing the portal, you'll be directed to a sign-in page. You'll need to use the same email address that's used for existing MHRA submissions in order to log in. You'll be logging in through your own corporate tenant, so there will be no local password storage, but you'll be directed to a sign-in page and you'll be able to use the same email address that you currently use for existing MHRA submissions through the Human Medicines portal. Once I log in, I'll then be taken to a welcome screen. As I mentioned, the intention is very much that this will become the single front door to the agency and will enable a single customer identity to engage with the agency across all regulatory services. So this will replace the PCL portal and the Human Medicines portal and longer term devices as well. This welcome page, you can see, will become a customer landing page for engaging with the MHRA, so it may over time have additional tiles and options, including making a submission, account administration, and finance in future releases. For the first release, you'll see a welcome screen which details the 2 services. The first one, Track My Case, which shows the status of your application and what workflow stage it's at, and the See My Data service, or Current Granted View, which will allow you to view your live authorization details, as well as key data that's held against a license. You'll also see some related options on the right sidebar, and that will direct you to the MHRA submissions, as well as options to contact the MHRA. And we will provide guidance on different types of queries and the best place to direct them to ensure that your query is dealt with as fast as possible. If I click Continue to Applications, I'll then be taken to the first service, the Track My Case service. This will show a list of all organisations that you have access to, based on those organisations that you're mapped to currently in the Human Medicines portal. Everyone from the company will see the same data, so there aren't different permission restrictions or different roles in the system for the first release. Whether you're a company admin, a normal user, or a consultant, the service will be exactly the same and you'll see the same data and have the same permissions. You'll see historic cases for all live authorizations, so we haven't set a cutoff in terms of date, but you'll only see anything pending as well as the latest granted regulatory activity. I can see on this screen all of the case numbers, as well as the date that's received and the submission status for those cases, and I can choose to filter and sort in order to see the cases that I'm looking for. At the bottom of the page, I can also see an explanation of each of those statuses. And I can see what those workflow steps mean and what subsequent workflow steps may be for that assessment. You won't be able to see detailed timelines for individual cases, but this will provide an indication of where your case is within the overall regulatory lifecycle in the assessment process. On the left-hand side of the page, I can also see a number of quick filter options. And I can choose to search for cases as well. I can filter for organisations I have access to, so for third parties or consultants, I may have a number of different organisations listed there. I can also choose to filter for particular submission workflow statuses. So I could filter for cases that are awaiting an RFI response or awaiting VCR, as well as any cases that are in assessment. I can also choose to filter for different license types, be that PCL licenses or PLPI or product licenses as well. And I can also finally choose by application type, so I can easily filter out those cases that are initial submissions versus any renewal or variation cases. All of the quick filters will then be listed at the top, and I have an easy link to remove those filters as well. Upon clicking on a case, I'll be taken to the application details page. And this will surface key high-level information about the case, including the submission status and the case number and the marketing authorization holder. I can also see again what application type it is, so whether it's a variation or an initial. And I can also see the status of the live authorization. So as this is a variation case, I can see that that variation is in assessment, but I do have a live authorization status of granted for the live license. Clicking on Current Granted View in the Related Actions section takes me to the second service, the See My Data or Current Granted View service. The See My Data service surfaces key data that's held against my license. This will vary by license type, but for product licenses, the dataset is based off of the same data that's currently exposed through RAMA XL. On PCL, it surfaces a subset of certification data for in-scope license types. You'll be able to see key authorization details, as well as details of the marketing authorization holder. You'll also see details around formulation and packaging, and substance details and excipients. Scrolling down, you'll also be able to see that key documents are present. You can view the Summary of Product Characteristics, or SPC, the patient information leaflets, as well as key labelling information held against the license. In future releases, the Current Granted View will also provide me the ability to manage my license. So if I wish to request a license cancellation or apply a sunset clause or raise a variation, I can do this directly from the license page. Similarly, if I need to respond to a VCR or an RFI for a pending application, I'll be able to do this through the related actions on the application details page. Finally, the portal will also provide the ability to raise any queries to the agency. Whilst we are unable to provide specific timelines on individual applications and assessment processes, this will provide the ability to get in touch with the MHRA. For example, if I notice data inaccuracies, ensuring that these are updated and are accurately reflected in your license. We also have a form for generalised feedback on these services. You'll be able to comment on how easy the service was to use, as well as on guidance provided on the platform, and whether ultimately the service adds value to your organisation. These two services, therefore, will provide immediate benefits, giving visibility over submissions, but also it will form the foundation for longer-term functionality in services and interactions with the agency more generally.
Hi all, hopefully that video is a helpful demonstration of what you'll be able to see within our new RegulatoryConnect portal service, and hopefully it's something exciting that you can see a lot more of your data, your status tracking, and something that you can really get your teeth into when it's live at the end of the month. My name is Jessica Gianassi. I am one of the change managers on the Regulatory Connect programme, and I will walk you through an update on what you can do to get ready to use the Regulatory Connect portal. So you will receive a link to the Regulatory Connect portal when it is launched at the end of March, so you will be able to get access to that when it is ready. We will also be cascading out through our trade association heads as well, so you should be able to see communications cascaded out through them as well. It is a really self-serve, easy to navigate services. Hopefully you'll be able to see from that demo there, and from our early private beta testing, from our usability testing, users are finding it easy to navigate around. However, we do appreciate, obviously it is a new service, and so we have also been creating guidance to go along with the portal, so that you can navigate around it with as much ease as possible, and hopefully answer any of those questions that you have as you use the new tool. That will be also shared on out when you get the link to the Regulatory Connect service, and will be accessible to you throughout your usage of that. We will also make sure that you're able to see some of that kind of video content as well, to refer on back to. The idea being that this is a great time to get familiar with that kind of GovUK type of portals, content site, apologies, so you can get yourself more familiar with that kind of interface as we continue through our Regulatory Connect journey. There isn't a long list of things that you have to do to get ready, I'm pleased to share, but we did want to make sure we'd called out a few things this afternoon. So as Oliver mentioned earlier, this is linked to the Human Medicine portal accounts, and so for everybody who is currently using that system, we would suggest that you take the time to make sure that you are linked to your organisation or organisations as expected on that portal, to make sure that when you do get access, you'll be able to log in and see your relevant data. For admins, this means that we suggest that you do make sure you take the time to have a look at who is currently on your list of users, and make sure that it is up to date, whether that be a case of making sure some new joiners are added to that, or whether actually there's some older legacy names and accounts linked to that. It is an important time just to make sure that you're comfortable with those user lists whilst you have the chance to. And finally, for our IT teams, although there isn't anything you can do in advance of the portal being launched later in this month, it is important that we note that it is a new web application that we're obviously launching, and so it is possible that you may get users having to submit a request for approval for the new application. You won't have to do that for every individual using the portal. It was just a one-off approval, we're pleased to share as well, but just to make sure that it is on the radar of those IT teams, and that those requests are likely to come on through when people first have access to the tool. Brilliant. So that brings us through to the end of our content, to walk you through both a little bit of an update on Regulatory Connect as a programme, as a broader activity piece from Mick, our SRO, and from Oliver, our product manager, to walk you through the service, along with the demo and a little bit of a summary on what you can do to get ready to use the Regulatory Connect service at the end of the month. Over to you, Mick.
Well, thanks very much, Jess, and thanks, Oliver, Rob, Anthony, for joining the Q&A. I think, as you said, Jess, the number of cues that we try to answer, I think, demonstrate the level of interest and the importance of getting the guidance right. And as we edge closer to that release 1 date, we'll make sure that the guidance for you covers the questions asked today. I hope you have, through the course of the last hour and a half-ish, got an understanding of the programme, what's coming first, what's coming next, and what might be a little bit further downstream. I think I would like to end by saying, within the agency, this programme has been prioritised as the #1 programme for the MHRA. It goes very much towards, and I did see a question that we didn't get round to, around the agency's performance, throughput of things. Regulatory Connect is absolutely essential to the sustainability of the delivery of the MHRA's services to the level that is required of us and expected of us. The legacy systems that we currently have in place are slow. They slow us down. They are not modern. They need to be replaced. But it's not just the IT. It's the approach and the ways of working that are being delivered alongside the technology or as part of the technology replacement. So when we talk about the delivery of the agency's services to that high performance that we expect of ourselves and you expect of us, the Regulatory Connect program is central to delivering that. We're on a journey. Release 1 is the first part of it. Release 2 will deliver that big kind of next step of the whole new IT platform for process and product licensing, which will replace those clunky old systems that I've referred to. So keep with us on this journey. We will be doing much more of these kind of engagements as new features are released that are relevant to you all, and we will publicize these in the normal way. We're also talking very closely with the trade associations. We have regular updates on the program with the trade associations. So hopefully the information flow will pick up its pace, and I encourage you all to keep in touch with us. Thank you all for attending this afternoon, and I wish you a good afternoon. Thank you all.
Thank you, Mick, and thank you everyone for attending today's webinar. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate if you would complete that and provide your feedback. You will also receive a follow-up email in the coming weeks with a link to view a recording of today's webinar. On behalf of the MHRA and our presenters, thank you for joining us today and enjoy the rest of your day.